The Czech Republic and Slovenia also reported their first cases on Tuesday, joining 18 other countries to detect the virus outside its usual Africa base. That number is expected to rise further still. But experts say the overall risk to the general population remains low. Outbreaks of the virus have been found in Europe, Australia, and America. The symptoms often include a fever and rash, but the infection is usually mild. In the UAE, health officials announced a case had been detected in a traveler who had recently visited West Africa and is now receiving medical treatment. Authorities there say they are fully prepared to handle any outbreak, adding that early surveillance protocols for detecting the disease were in place. The World Health Organization says the virus can be contained with the right response in countries outside of Africa where it is not usually detected. We encourage you all to increase the surveillance of monkeypox to see where transmission levels are and understand where it is going. The WHO's Director for Global Infectious Hazard Preparedness, Sylvie Bryant, said at a conference on Tuesday, "The outbreaks may not be normal but remain containable." She added, "Outside Africa there are now 237 confirmed and suspected cases of monkeypox, and health authorities around the world have announced plans to contain the virus." Germany says it has ordered up to 40,000 doses of the mRNA vaccine, used to treat smallpox, but also effective against monkeypox, to be ready in case the outbreak worsens. Anyone already vaccinated with a smallpox vaccine years ago as part of a global bid to eradicate the disease should have existing immunity, German health officials said, but they added that the older treatment has more side effects so is not suitable for fighting monkeypox today. And in France, which has detected 3 cases, officials announced a targeted vaccination campaign of adults who had been recently exposed. Authorities there are recommending that a vaccine be given within 4 days of exposure, but up to 14 days afterwards if necessary. In England, officials announced on Tuesday that 14 more cases of the virus had been detected, bringing the total number of cases in the UK to 71. Monkeypox is usually associated with travel to Central or West Africa, but some of the cases which have been occurring outside these countries have had no travel link. It does not spread easily between people, but it can be spread through touching clothing, bedding, or towels used by someone with the monkeypox rash, touching monkeypox skin blisters or scabs, the coughs or sneezes of a person with the monkeypox rash. If you get infected with monkeypox, it usually takes between 5 and 21 days for the first symptoms to appear. Symptoms include fever, headache, muscle aches, backache, swollen lymph nodes, chills, and exhaustion. A rash can develop, often beginning on the face, then spreading to other parts of the body. The rash changes and goes through different stages, a bit like chickenpox, before finally forming a scab, which later falls off. Monkeypox is caused by the monkeypox virus, a member of the same family of viruses as smallpox. Although it is much less severe and experts say chances of infection are low, it occurs mostly in remote parts of Central and West African countries, near tropical rainforests. There are 2 main strains of virus, West African and Central African. 2 of the infected patients in the UK traveled from Nigeria, so it is likely that they are suffering from the West African strain, which is generally mild. Another case was a healthcare worker who picked up the virus from one of the patients. More recent cases do not have any known links with each other or any history of travel. It appears they caught it in the UK from spread in the community. The UK Health Security Agency says anyone with concerns that they could be infected should see a health professional, but make contact with the clinic or surgery ahead of a visit. Initial symptoms include fever, headaches, swellings, back pain, aching muscles. Once the fever breaks, a rash can develop, often beginning on the face, then spreading to other parts of the body, most commonly the palms of the hands and soles of the feet. The rash, which can be extremely itchy or painful, changes and goes through different stages before finally forming a scab, which later falls off. The lesions can cause scarring. The infection usually clears up on its own and lasts between 14 and 21 days. Monkeypox can be spread when someone is in close contact with an infected person. The virus can enter the body through broken skin, the respiratory tract, or through the eyes, nose, or mouth. It has not previously been described as a sexually transmitted infection, but it can be passed on by direct contact during sex. It can also be spread by contact with infected animals such as monkeys, rats, and squirrels, or by virus-contaminated objects such as bedding and clothing. Most cases of the virus are mild, sometimes resembling chickenpox, and clear up on their own within a few weeks. Monkeypox can sometimes be more severe, however, and has been reported to have caused deaths in West Africa.